So here's a case study that proves the point. On the left-hand side, you have what I call the marketplace playbook. This is business school 101. This is what happens in an economy like ours when the business model begins to change and the companies working in the business model don't begin to change with it. So first you have fast-moving technological changes or changing physician practices. This results in a declining demand for services. This then results in falling prices followed by falling revenue. This then results in job loss and cost cutting. This then forces the participants in the space to go through mergers, acquisitions, and closures. And eventually then this results in a reduction in the number of firms in the market. This is the equilibrium of supply and demand. You have falling demand, and eventually you have to have falling supply. If you don't have falling supply in the face of falling demand, then you can't stabilize prices. If you don't stabilize prices, you have free falling prices, and then everybody in the industry goes bankrupt. So is this actually happening in healthcare? It turns out it absolutely is. Blood banks. Because of the move from inpatient to laparoscopic surgery, the change in cardiac and hip surgery protocols, and the impact of the electronic medical record, the units of blood transfused in the United States declined from 15 million units in 2009 to 11 million in 2013. Isn't that unbelievable? And this is all because of the things we've just done in the last 5 or 6 years. Transfusions are dangerous. And doctors finally got organized around this and said transfusions in many cases are necessary to save the life of the patient. But in many cases, we just go overboard in what we're doing, and we actually do significant damage. And so the heart surgeons of America and the hip surgeons of America started saying, we want to conduct our practice in a way in which we do less damage and we're more careful. And as a result, 4 million transfusions disappeared from the marketplace. Once hospitals figured out that the demand for transfusions were declining, they immediately pushed for lower prices, because that's exactly what you would do. And total blood banking revenue declined by $1.5 billion. As a result, there were significant cuts at Red Cross and an estimated loss of 12,000 blood banking jobs over the next several years. Just like you would think from your business school case, blood business has been hit by a wave of consolidation, and the American Blood Center, which is essentially the AHA of blood banking in the United States, has had its membership decline from 87 companies 5 years ago to 68 today. Now, I put this out here because this is exactly what's going to happen in other verticals of healthcare, and I certainly expect that this is going to happen in the hospital vertical as well. And if you're not prepared for this, then you will be one of those firms that will disappear in Business School 101.